Hi everyone, I'm Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I'm going to do another patient-centric video on the topic of patient responsibilities. This is a new series that I'm doing. I usually do videos that are geared towards healthcare professionals. However, having worked in healthcare for over 20 years and also being a patient myself at times, I know the struggle that patients have with understanding the healthcare field in general when it comes to their side of things, but also understanding the side of the healthcare professionals. My goal is to bridge the gap to help everyone understand each other's side, if you will, and to promote patient confidence when they see healthcare providers, and to be able to have intelligent conversations and knowledge base to enable that confidence. So today we're going to talk about patient responsibilities. I've released previous videos on insurance definitions. So if you're not familiar or very good at understanding your benefits with the insurance companies, such as what deductibles are, co-pays, in-network, out-of-network, please check out that video. It will be very handy. I've also released a video on patient rights, what rights you have as a patient, because a lot of patients seem to either forget or not be fully aware of what their rights are, and I think that's really important, so check out that video. And what goes with that are patients' responsibilities, and that's what we're going to talk about today. There are 6 big patient responsibilities that we're going to talk about today. I'm not going to go into a lot of detail because I could do that in individual videos. So today I'm just going to list them and give a brief understanding or explanation, if you will, for an understanding of what patient responsibilities are, especially coming from working in healthcare and being a patient myself. I can give kind of both sides to these, okay? So the first one is going to making sure that you are keeping your appointments that are scheduled, and with that, arriving early. The time that you are given, and I know this is misleading, but when you schedule an appointment, whether it's for a lab appointment, diagnostic imaging, with a provider, therapy, whatever it is, the appointment time you are given is the time that they expect you to be in the room ready for something to happen, whether it's to see the provider, the nurse takes you back, to get the blood drawn, to have the test done. It is not the arrival time. The arrival time, you should always arrive about 10 to 15 minutes early so the front office or whoever checks you in is able to verify all of your information with you, which is going to be another one of my points here soon, and make sure everything's good to go so that it can all be billed to where it needs to be billed to. So first one is keeping your appointments. Don't no call, no show. That's very rude. Don't cancel last minute unless obviously there's an emergency, and arriving 10 to 15 minutes early. The second one is ensuring that you're keeping all of your information updated at your doctor's offices. This means your address, your phone number, your email address, your insurance information. It ultimately is the patient's responsibility to make sure that anywhere that you go for medical services has your most up-to-date information. And one of those responsibilities of being a patient related to this is making sure you have your insurance card on you at all times so that they can make a copy of it. Whether you were just in a month ago, a week ago, yesterday, you should always have your insurance card with you. It should be like your driver's license. You should be carrying your insurance card and your driver's license together at all times because you are always going to need to show your insurance card. If you do not and they don't ask for it, offer it to them. Say, here is my insurance card. Do you want to look at it? At least you're doing your due diligence. When they ask you to verify your information over the phone when they're scheduling you, also when you check in, you cannot be annoyed and be rude. That is not okay. They are trying to make sure as a business that they are doing everything they can to make sure that there's not going to be any issues when bills need to be sent. And that is not necessarily a bill to you, but it could be if you're not updating your information. When they verify your insurance information and they have your most updated information for your insurance, they first bill your services to insurances. So they want to make sure that you're getting the most bang for your buck as well, because let's be real, insurance is not cheap. And we want the insurances to pay everything that they will for the services, but they can't do that unless they have the right information. And it is your responsibility as a patient to understand your benefits and to be able to help the doctor's offices with your coverage and how to bill it. That leads me to my next one. Number 3 is understanding your insurance benefits, especially if you have more than one insurance. It is your responsibility to know which one is your primary that should be billed first and which one is your secondary that should be billed second. And then if you have 3, which is rare, but it does happen, which one should be billed third. Remember that the doctor's offices do not have to bill the insurance on your behalf. They do it as a courtesy. A lot of doctor's offices still, even though it's old school practice, will print you out a claim on what's called a HCFA 1500, and it will explain all the services, and they will say, here, you can bill your insurance, but you need to pay us the cash price right now so that we get paid for the services, and you're responsible for collecting from the insurance for this. They could do that. They have every right. However, as a courtesy, they do not. So they're taking on, and let me tell you, it is a burden to bill insurances anymore. They are making it harder and harder every day to get things covered. So if you don't understand your coverage, if you don't know what your deductible is, you don't understand that you have a copay, you don't understand that you have to see in-network providers, then when they come to you and say, oh, you have a bill because you haven't met your deductible or we're out of network with your insurance, yes, it would be nice if they could give you that information ahead of time. However, it's still your responsibility as a patient to know this before you go, to pick doctors that are in network to get the most coverage for your benefits, to understand how much you have left on your deductible so you don't feel like you're being shocked when you get that bill from the doctor's office. And I'm going to be honest with you, I hear this all the time. Doctors make so much money and they don't need my money right away, yada, yada. I've heard all of it. And I'm going to be honest with you, a lot of doctors don't make that much money. Yes, they make a lot of money compared to maybe other professions or other people who work. However, they pay a lot of money for their profession and they are doing a special service to all of us to take care of us. And if you look at how much they have to go through to build the insurances and to hire all the staff to follow the compliance and the regulations and stuff, doctors really don't make that much money with the comparison of all that they have to go through to do what they do. And that's the purpose of this channel, and I'm digressing, I apologize. So number 3 is you need to know your own benefits. So just to recap, since we're halfway through, 1, you need to keep your appointments and show up earlier than your scheduled time. 2, you need to communicate any changes to your information, your personal information and insurance, and carry your insurance card with you when you go to the doctor or any medical service. 3, you need to make sure that you understand your insurance benefits. Number 4, you need to ask questions. If you don't understand what your doctor is telling you, if you don't understand the results of something, if you don't understand a treatment plan or the end results or the goals, if you don't understand or something needs more explanation, ask a question. That is your right and your responsibility to feel like you can do that, and you should do that. You should not follow things blindly just because. You have the right to ask for more explanation, but it is your responsibility to ask that question and ask for more explanation or ask whatever is on your mind, because if something were to happen and you come back and go, well, I didn't ask because, well, no, it's your responsibility. It's your health. It's your child's health, whoever you're advocating for, maybe a parent that you're responsible for. You need to ask the questions. If you're not sure about your bill and you don't understand, it seems really expensive, ask the question. It's okay. That is what this beautiful life is about is learning. And it might be something that you don't know about or you're not aware of, and you will learn something new. It could be that there was a mistake and you caught it. And by asking the question, you are going to prevent future mistakes, or you're going to prevent someone else from having the same mistake done to them. So you have to say something, not just ask the question, say something. It's your responsibility. Number 5, you need to follow your treatment plans that your provider has given to you, and you need to communicate with them. You need to let them know how you're feeling and be honest. Your responsibility is honesty with this. You have to be honest about following the treatment plan. You have to be honest about how you're feeling. You need to be honest about the medications you're taking. You need to be honest about how much you drink, how much you smoke, the drugs that you use. Doctors, providers, therapists, they can only help you if you help yourself. And helping yourself is going to be honest and putting things out there so that they're aware and can consider it and put it into any kind of treatment plans or possible treatments that they want to give you, but they can't if they don't know. They can't read your mind. They're not going to assume, because that's bad medicine. So they're only going to be able to help you as well as you can help them help you. So you need to make sure that you're honest, that you're communicative, that you follow the treatment plans. If you have an issue with any of that, say something, ask a question. And my last one is pay your bills. I know it's tight times right now, and I understand that paying a medical bill is no fun, because I'm a patient too, and I have a high deductible plan, and I hate paying the doctor's bills. But it's not the doctor's fault. I'm the one that signed up for the health plan that I signed up for. I'm aware that I have a high deductible. I'm aware that I have copays, and I need to pay them. That's my responsibility. That is what I signed up for, and I cannot punish them, because although medicine is service to us as consumers, it is also a business, unfortunately. And if we don't pay the bills, then our really good providers that we really like and the staff that we feel comfortable around might not be around forever, because they need that money to keep their doors open. And like I said before, running a practice is very expensive, especially a small private practice, and trying to keep your doors open and maneuver through all of the administrative burden and the complexities of compliance and regulations, it gets really cumbersome and it's not cheap. So please pay your bills. If you can't afford the bill that you have, communicate to them. Let them know that you got the bill. However, you can't afford to pay it all at once, and ask them if they can do a payment plan with you. A lot of them will do short-term payment plans because they understand, and they will have some kind of form to fill out, some agreement, and you can go from there. But they're not going to go out of their way to offer that to you. You need to ask, going back to one of my previous points, and you need to pay your bill. Okay? These are things that are your responsibility as patients, and you need to take ownership for it. And working from the side of the clinic, I can tell you a lot of patients have forgotten this. Very disheartening, and it's very hard on your providers, on your staff, when these things aren't followed by patients. Keep these in mind. If you have any questions, I'm here as a resource. Please feel free to put your comment down below. I would love to try to help you. Smash the thumbs up button if today's video was helpful. Please subscribe to my channel if you haven't already, so that you can find my videos easy when you go onto YouTube. There's a little bell that you can select, so it will notify you when I release new videos. I do them every other week on Wednesdays, just so you know. And you can share this, please, with your friends, your family, anyone who you feel would benefit from this content. I would really appreciate it. If you have a video idea that you would like me to do because it's something that you're confused about or you're not aware of but you want to learn more, please leave that in the comments as well. I would love to have your feedback and would have ideas to release videos for you. Again, thank you so much. Keep yourself well. We'll see you next time. Bye-bye.